I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Hello, and welcome to this episode of IDD Health Matters. Today, we've got a great guest, Wesley Anderson. Welcome, Wesley.
Thanks for having me.
So, Wesley, you work with NASDS, which is the National Association of State Directors of Developmental Disability Services. Did I get it right?
You got it.
Okay, all right, it's a mouthful. And we're here at the annual conference, or one of the conferences here in Salt Lake City right now. And you know, you were talking about employment, and I'm going to ask you to tell me your full title in a minute, and I don't want to mess it up. But, you know, employment is one of the social determinants of health, and social determinants of health are things that affect our health that aren't specifically health related. And being employed actually has been shown to increase the opportunities to have good health. Am I correct in that?
100%.
All right. So tell us your title with NASDS and what you do.
So I am the Director of Employment and Community Services, and I am the co-director within that of what we call the State Employment Leadership Network, which is a 26-state kind of learning collaborative for state leaders at the DD agencies to explore and to improve policies related to employment for individuals with developmental disabilities.
So go ahead and expand on that a little bit more. What does that look like? What do you do?
It's a lot of questions, a lot of technical assistance, digging into what a state has done, what are its goals, how multiple levels, how has it committed to employment. So it's not just what's written down in their policies, it's also what's their leadership structure like, what's their funding methodology look like, what are its connections to its advocacy groups or provider agencies. So it's trying to pull employment out of kind of a side room in a silo and say, how are you threading employment holistically throughout all of your services? Because you're absolutely right. It is a social determinant of health for the ability to create and charge your own path, and a large sense of identity is tied to employment. And how often do people say, what do you do, is one of the first ways to greet somebody. So yeah, states are really committed to exploring it, and anywhere that they want to take that conversation, that's where my team and I try to follow them.
So this may sound like a silly question, but why do we need to focus on employment for people with intellectual and developmental disabilities?
That's a great question. I call it a downstream problem, because if you have solved, or if you could solve for employment, you would have had to solve for so many other systemic barriers along the way.
It's a good perspective. I like that.
Let's think about transportation. You know, transportation is not just a barrier to employment, it's a barrier to community living in general.
And getting healthcare sometimes.
Visiting your family. If we could solve for the part of transportation that's related to employment, we would have already addressed that other issue. Food insecurity, for instance, right? A lot of that can be minimized if you have competitive integrated employment. Loneliness and isolation. There are so many areas that you might not necessarily connect directly to employment, but a healthy ecosystem that supports employment has to look at in order to really say they're doing what they want to do.
And food insecurity and social interactions, and those are some other social determinants of
They sure are.
too.
They sure are.
Environment that we're in. And you know, you made a point about social interactions. We have a lot of social interactions with work and people that we work with, and they often become our friends. Mm-hmm. And that all certainly ties to an overall sense of wellness and value and worth. And yeah,
I think often overlooked component culturally is the impact on expectations in early childhood. And so what do you want to do when you grow up for many is a foundational question. But if
It never
that
gets asked
never
to
gets
some
asked.
people, right?
yeah, what
Because if the assumption is made, you won't be doing anything.
correct, and how damaging is that to a young person's psyche, and how much does that reinforce or inform the decisions that they make and what they think is possible for them or for someone else like them, and what does that say to the people who are being asked what do they want to be when they grow up, right next to someone who's not.
Yeah.
And so employment does, I think, a whole lot.
I think you're right, and I love this very broad impact that it has, and the way you're explaining that, it makes a lot of sense. Just again, to a person's overall, well-being. So, are there specific things that you think people out there who are, let's say people out there who are employers, for instance, why should they look at hiring someone with an intellectual or developmental disability?
I think foundationally because they can do the work, and we know the data shows that individuals with disabilities tend to have higher retention rates than individuals without disabilities. There have been a lot of theories as to why that is, and people could speculate. But ultimately, I think people should hire individuals with disabilities for two reasons. One, because they can do the work, and a skilled workforce is a skilled workforce. And two, one of the best ways to increase your business is to reflect the communities that you want to patronize. And so they are your communities. They are the person that you want to buy or use your services knows someone with a disability, has someone with a disability, and their families and their extended social groups. And if you aren't reflecting that, you're losing out on business.
Yep. Good points. Now, is it also true that you mentioned people or the retention is often better, and in like punctuality and being there and showing up for work often better as well too. And if I'm, correct me if I'm wrong here, but isn't there sometimes a misconception that there's so many accommodations that have to be made for a person with a disability to work in my, area or my job or whatever, and it's just going to be too time consuming and too challenging? But that's not really the case, is it?
No, a majority of accommodations cost under $100. And there are ways for an employer to get assistance with higher cost accommodations that aren't that might be close to an undue hardship. But ultimately, this concept of universal design comes to mind, and that you may think you're building a ramp for a person with a wheelchair, but you're building a ramp for anybody that wants to use a ramp. And that person with a wheelchair can also access your building. And so a lot of the things that people consider to be accommodations for a person with disability are just better business design.
That's great. A great example. One of the other ones that I love thinking about is, the curb cuts that you see. You think, oh, those are for people with, who are in a wheelchair so they can roll up a curb. But what about people who are pushing a stroller or pulling luggage or whatever? It benefits everybody. Yeah. So those accommodations, like you said, can really, really benefit everyone. And now some people do need maybe a little extra support to learn their job or to do well at their job. Is that a part of the system?
Absolutely. Actually, early on in my career, I provided employment supports. I was something called an employment specialist, and my whole job was working with people with disabilities to help them find to decide what their skill sets are and obtain and maintain competitive employment. And so I was working with employers and negotiating job matches and working on site with individuals to train them on how to do the job and to train the employer on how to be a better boss. And it's a robust industry that sometimes is a little bit hidden away. And those services were provided at no cost to the employer. I was considered an accommodation, the same that ramp or that curb would be. And so there's a lot of opportunity to get assistance. There's a whole field of professionals that do this work every day.
Makes a lot of sense, and it's definitely out there. So what would you say would be some common concerns? Maybe we've already mentioned some, but maybe we haven't, that an employer might have that you want to address or dispel.
I guess one of the first ones is that the person will interfere with their business. A job coach or employment specialist would interfere with their business. And I think what I always like to say is, you don't necessarily need to be on site in order to provide assistance. There are many times where I would meet with an individual after work or before work or during break time or whatever that might be, in order to not interfere with the flow. And additionally, we want to back off as much as possible so that you can be an employer to your employee. Generally, there have been some concerns about safety or liability, and I think I'd say to that your responsibility to anybody within your business is the same, and the science and the data does not show any increased trends of liability for individuals with disabilities related to employment. I think it's something that might feel truer than it is to some people, but it's not. The math doesn't work out that way.
All right. So you hear it out there, employers, right? Okay. So Wesley, how did you get into this line of work? How'd you get into this field?
My family started, they owned a martial arts school for many years. And they started working with kids from Division of Children and Family Services very early on. Eventually I worked at a at-risk youth facility for kids that had dropped out of high school. I moved into special education. I moved into employment services. And then I started training all of the employment service providers in the state of New Jersey before getting involved in some national work and then coming to NASI. So it seems very one thing than the other, but I can tell you it's only a career in hindsight. I didn't know what path I was walking, but now it seems pretty self-evident that I was always doing something fairly similar.
What would you say to people out there who are considering maybe working in this field, even not necessarily employment services, but just working in the field of supports and services for people with intellectual and developmental disabilities? Would you recommend it?
Absolutely. I think in the same way that I described employment as a downstream barrier or problem to address, I think working in health and human services in any capacity, there are so many transferable skills that, just in our conversation, we're talking about economic stability. We're talking about labor demands and organizational design. We're talking about so many other areas. Technology, person-centered thinking, where you can go from time in this space is pretty infinite. And I think that that's one of the things that's really great about it. It is customer service, but it is also human services at the same time. And if you don't know where you want to go, I guarantee you working in this space will identify where you can shine most.
Yeah, I love that.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So, Wesley, it's time for 3 and 3. So it's 3 things in 3 minutes, but I'm not going to hold you to the 3 minutes.
Okay.
Just like saying 3 and 3.
Let's catch up.
Yeah. 3 tips, words of wisdom, pieces of advice, anything that you'd like the world to know that you think can improve the world or supports and services for people with intellectual and developmental disabilities.
Jeez, this is my legacy.
We can do it again if you want another time.
Oh, thank you. I'd love that. I think kind of foundationally to my core personality is I think curiosity is the strongest positive trait that a person can have. And a lack of curiosity is the opposite. I think if you are truly, genuinely curious about the world around you, about people, about what you can do better, I think you will find a positive path. And I think a lack of curiosity is restrictive and it limits us and our ability to impact the world around us and to connect with people that we might genuinely have something in common. I mean, just the question that you asked earlier today, if I wanted to speak here, if you don't ask that question, we don't have this wonderful conversation. So
that's right.
And as a kind of corollary to that, I think that the questions that we ask are ultimately many times more important than the declarative statements that we make. How can I help you? What can I do for you? What's wrong? I think our systems need to ask better, more proactive questions. We need to ask in our school systems, how are we preparing youth for a real world in the community, for real life in the community? What can we do to bridge the gap between areas that are impacted differently, different socioeconomic status? And what can we do to be better neighbors and community members? And I think lastly, that it's okay to take time for yourself to really process on your own the work that you do and the work that you want to do and the impact that you're having. And I think some of that time to really process has been helpful for me in my life, in my career. And I can feel times in my life where I have not done enough of that and how it ends up impacting my relationships, professional and personal.
Those are great words to live by, for sure. Wesley, thank you so much for taking the time to talk with me today, and more importantly, for the incredible work that you're doing in this field.
Thank you. It's a pleasure.